Carfi. She is the Deputy Director of Open Data Charter. She has previously worked as the Open Government Director for the Undersecretary of Public Innovation and Open Government of Argentina, where she coordinated the co-creation of the third Open Government National Action Plan. She was also Open Government Coordinator for the Digital Division of the Government of China and for the city of Buenos Aires. Natalia is also part of the Open Data Leaders Network and the academic committee of the International Open Data Conference. We are very thrilled to have her today with us to talk about open data and COVID-19 and emerging challenges and how that implicated their work at Open Data Charter's work.
Hi, everybody.
Hi.
Glad to be here. Thank you very much for the invitation. And if it's all right with everybody, I'm just going to share my screen. Please do let me know that it's being shared properly.
Warm regards from Kosovo. We're here today with the whole team, and also a lot of other community members have joined virtually. So thank you so much for your time, and we look forward to your session.
Thank you very much. And thanks again for the invitation. My name is Natalia Carfi. I'm the Deputy Director for the Open Data Charter, and I'm now based in Buenos Aires, Argentina. So here is good morning from here, but glad to be here in this session. Let's go straight into the work that we've done. So first, let me introduce a little bit the Open Data Charter. So the Open Data Charter is a collaboration between governments and experts working in open government while we protect fundamental rights. We've turned 5 years this year, 2020. So we're really happy of this 5 years that we've had already working with governments globally. And the Open Data Charter was born out of a discussion, an international discussion that took place around principles for governments to open up data. So the 6 principles that were agreed among different governments, multilateral, civil society organizations over a discussion of a year and a half, actually comprehend the core of the Open Data Charter. And so they can be used for opening up data in any government, any part of the world, at any level of government. What you see now is a map of the Open Data Charter government adopters. And we keep having adopters coming in almost every 2 months, and gladly. And hopefully we can keep that trend in 2021. What you see here are the 6 principles that I talked about. These are the 6 principles that were agreed as part of the Open Data Charter. And we actually went through a revision of the principles in 2018 to understand if they were still interesting, if we needed to make any changes. As you know, technology and public policy are an ever-changing, ever-evolving thematic area, and so we went through a public consultation, and the principles were actually agreed to still be sound and safe. So we're still working with the same 6 principles. Sorry, my cat decided to join the conversation, working from home. So these are the 6 principles, which are pretty straightforward. And of course, you can see a lot more information in our work page. I don't want to take too much of our time here, but are basically 6 principles that any government can use to promote open data policies. And so let me tell you a little bit of what I've come here to share. Of course, we were impacted by COVID-19, both as a person, but also as an institution. And so we decided to do something about it. and work around COVID data, understand what was going on in the openness sphere of COVID data, and work towards bringing in what we can bring, which is our work and our role as a global convener of actors, of governmental actors, of multilaterals, of civil society organizations. And so we took on that role, that position that we already have, to try to add value to the work that everybody was doing around COVID-19. Here's a small timeline of the work that we've done and that I'm going to be going through in this session. So the first step was probably early March, at the end of February. We were seeing this pandemic just kaboom everywhere, impacted globally. And so we started seeing, of course, a lot of organizations asking for data to understand what was going on, how governments were making decisions, what decisions were made that were impacting citizens' lives, restrictions and prohibitions. And we understood that data was needed, but what we saw was a lot of different requests, not being able to make like a comprehensive or a comprehensive request or demand of data. So what we created was a first document. It was a totally humble Google Drive document where we started putting up the most demanded data sets or data cards that were being demanded by the open data community worldwide. So we gathered information this information from data, not only epidemiologist data and health system data, but we also understood that more social, demographic, and economic data was needed in order for citizens to be able to understand what was going on. So we created a first list of critical data cards and opened up that document to the Open Data Network just for comments. And we got a zillion comments from all over the world, from different types of organizations, commenting on certain data cards that should be added, more information or standards that already existed, what certain governments were already doing, opening up data. So we have a document with a zillion comments, and that's part of what we do in the Open Data Network, kind of collaborate and share thoughts and ideas. And it was an amazing start. And then out of that, we started creating and kind of institutionalizing that collaboration. And we moved forward to step 2, where we decided to partner with certain organizations that were already doing work on open data for COVID. So we partnered with OECD, with GIFT, with GovLab, with NYU's GovLab, the Open Data for Development Network, and then the government of New Zealand and Mexico, who were already working on publishing COVID-related data in open standards. And we got a little funding from the Development Bank of Latin America and Luminate to progress with this work. And so in step 3, we started developing the documents that we are about to release right now, which is kind of 2-level documents. On the one side, we took this initial Google Drive with all the comments and all the data cards and all the proposed standards and data demands, and we started working on actually understanding the standards that exist, the different levels of publications that could be done, which are the critical actual data sets that are needed to understand what is going on as far as COVID itself, but also as far as I was saying, food security, economic impact. And so it's trying to understand in a comprehensive way what's going on and how citizens' lives are being impacted. Of course, health-related information is super important, and that's kind of the first data sets that should be released. But it's also important to be able to understand the whole picture, kind of the fiscal, the fiscal changes in the budget, the new purchases, emergency purchases that are being done. So we worked on creating those data cards, understanding which standards already existed there, in order to be able to make a proposal of how this data should be collected and published, not only for COVID, but also understanding that this might not be the only pandemic that we go through. I hope I'm wrong on this point, but we don't know. So the idea is to create this kind of open pandemic data cards in order to be able to be more prepared for if anything else should happen. I hope it doesn't, but we need to be able to deal with that. And then we also started working on policy proposals for governments. So not only working with data standards, data taxonomies, but also understanding which proposals we could do to our adopters in order to be able to handle the pandemic better, always on the data openness side, no? Which is the one that we work on. So understanding which steps should be taken on a policy level in order to be better prepared or to better manage the pandemic. What we understood is that we were working on kind of a global overview of both of these aspects of our work, and in conversations with the government of New Zealand specifically, and then of course with every other organization that we were working with, we decided to start doing COVID-19 meetups. And so to understand the local needs of data, because of course there's certain data sets that make sense everywhere, but then there are specifics in each community on which data is critical. And it's super important to understand that in order to make to create better accountability systems, in order for citizens to understand better what's going on. And so we started promoting and help run COVID meetups to understand those local data needs, data demands. And so we held, I guess it was around 10 COVID meetups around the world with different governments and different languages in order to be able to capture that. Also to understand if the global work that we were doing, like the data cards for on a global overview, made sense, but to understand which are the data demands on a local level. And right now we're working on the final versions of these two documents in order to be released, I hope, early next year. What we've been working on is what we've talked about the 4 R's: the readiness, the response, the recovery, and the reform that needs to take place because of COVID and because of the work that we've been doing, the impact that has had in our work this year. So we understood that there were different phases of like the data aspects of this work, and we've been talking about readiness, and this also has to do with what I said about the data cards work and the policy proposals, understanding how governments can better deal with this kind of global pandemic problems in a better way. So which is the things that need to be in place in order to rapidly respond and adapt in order to have better responses and to these kind of global problems. The response, of course, has to do with what is going on, like right now, what happens once the problem is already there, once COVID is already declared a pandemic. So how are governments responding? And also it's really important to understand the disproportionate impact in certain groups, in minorities, in migrants, in socially excluded communities. So data can help us shed light over that. Of course, the whole world is important, but we need to take a special look into this to see to these groups, to these minorities, in order to see how to better respond for those in exclusion processes. So the idea is to work on response, like bringing a lot of light into the work of this disproportionate impact that COVID is having. Then the recovery phase, we are kind of entering into that, which has to do with once COVID-19 is being handled, now we're seeing some vaccines happening and being put into use. So how do we help with data, understand the sectors that are under most distress? What are the support policies that are going to be put into place? How, for example, in foreign aid is being also used to help these sectors? Which measures are gonna be taken? How can we help for a green recovery to take place? So which is the data and the policies that we should move towards that? And then, as I was saying, as part of readiness, and this is like a whole cycle of work, which reforms need to take place in order to be able to create and share the critical data that is needed to move through all these other 3 R's. And so that's where I wanted to do a double click on the work that we're doing on the data taxonomy. As I said, we got a little help from Luminate and CAF, and we are collaborating with partners in this because it's a massive piece of work. And so we are investigating 25 countries, understanding, as I said, the epidemiological work, but the response capacity, the health system response capacity, because of course it's critical in the middle of a pandemic like the ones we're seeing, but also understanding that there's also critical data that needs to be open around social problems and the social state of the art before the pandemic started, what is going on right now, food security data, financial data, and of course public procurement, because every government in the world is doing emergency purchases, and so also understanding how the budget is changing, which are the priorities through the use of public funds. So that is also in order for citizens to better understand how the holistic way of dealing with the pandemic it's moving forward everywhere in the world. So that is a massive work that we are doing in collaboration with partners from Paraguay, understanding also the different levels of publication that can take place, because when you are in the middle of a pandemic, we understand governments are under stress because they need to handle the pandemic. So our proposal will go into different levels of publication in order to propose like a lighter level of publication and kind of middle ground publication, and then of course kind of an excellency level of publication. We need to understand what's going on. We need citizens to understand what's going on. Uncertainty and anxiety runs everywhere, and with better data, better information, we can understand what the government is doing and hopefully be more or be less anxious about what's going on. We will be publishing this early next year, in January, and hopefully get comments and endorsers from all around the world in order to move forward with this work. Key findings of the work that we've done this year so far. Well, data access gets crucial. Of course, now data is related with life or death response, so we need to understand the cases, the disease spread, tracking progress, and respond to the health crisis. We understood, and it was something that was shown to us like in our faces because of this, the importance of interoperability. Not only to compare among countries, but only inside the different levels of government in the same country. So the idea to be able to navigate data from subnational governments towards federal or national government, and be able to share that data, compare that data to understand also how the disease is moving inside the government. Oh, and of course, because of, for example, what's going on actually right now, like the frontiers being closed or between UK and certain countries. So interoperability among countries to be able to respond better, and also interoperability inside the same countries to understand what's going on and also respond better. So this was kind of, as I said, a slap to the face. We always talked about interoperability. Now we saw the actual importance of that in order to handle the pandemic. Then we saw also, and I guess this has to do with what everybody's been talking about, like how the pandemic actually moved forward with modernization systems that would have taken kind of 10 years to cement. Now they've moved forward. We need to talk and invest about data infrastructure, the data governance institutions that support the flow of data, that can actually work with accountable systems in order to understand and publish the data. That was also kind of a slap in the face. It's pretty obvious, but we need to keep on talking about that, because the countries that actually had the better systems, the better data infrastructure, the most robust data governance and interoperability systems were the ones that were able to answer in a better way in order to open up this data. So another thing that was kind of shed light into, we were already working on this, but COVID also brought in a new light into that. It was the discussions between open data and policy and privacy, sorry. So there's a lot of disease related data, like death and things like that, death cases and things like that, that are actually so personal data. So what should we publish? How should we publish it? So the discussion and the conversation between openness and privacy actually is happening right now. It was already happening, but COVID shed a new light, and it's really interesting to see how governments and data stewards are actually adapting to that conversation. There's not one answer, and we've seen a lot of different kinds of responses, sometimes emergency measures around this, but it's interesting to see how that is actually taking place almost everywhere. And then another one of the key findings or lessons that we've seen is the need for governments to be able to innovate in a rather quick space, in order to run fast with whatever is going on, and we know governments are sometimes difficult to I don't know, innovate in a fast pace, but COVID actually made us all move faster and differently from what we've done so far. So that is something that governments also need to move towards, and we've seen some cases of that going on. Then what we saw in like comparing these 25 countries, and also in conversations with different adopters of the charter, is there's a lot of governments that are still not opening up related data to COVID-19, that are not being as transparent as we wish they were, and so the lack of understanding what's going on actually impacts citizens, impacts work positions, businesses, and the country as a whole. So transparency is being once again the cornerstone of the data world, because we see the impact of not being transparent in almost every aspect of our lives. And then, as we learned from the experience of the meetups, understanding the local data needs, it's really important in order to develop the strategy. So of course we need, as I said, like as I said, promoting interoperability among countries. So we need standards and taxonomies, global standards and taxonomies. But then we also need to look back and understand which are the key data sets for our community on the most local level that we can in order to make citizens' lives a little bit better amid the pandemic. So the data needs, the data meetups were actually our way of promoting that, and it was a super interesting exercise. And of course, there was certain data that was obvious around the disease that everybody asks for, but then we saw the different aspects, the different local realities of the data that citizens actually demanded. So that is something that we need to, especially for us, for example, that we work on a global level, to understand the need to do that double click to go into the subnational levels and understand the citizens' needs on a much local level. It's super interesting, and we need not to forget that. And I guess those are the ideas that I wanted to share with you today. And once again, thank you for the invitation.
Thank you so much. In the meantime, in the beginning, I mentioned that we are going to have a little bit of Q&A session. So I shared a document with everyone here that is joining us virtually. But if you would like to open the mic and join the discussion, it would be much better. Anyways, I think we have some questions already that we can look at. So which one would you like to answer? There are three questions so far.
So I'll try to answer very humbly. What I don't know, I don't know. So I work on open data, but not in. I'm not an epidemiologist, so I'll try to answer as much as I can, and with my honest vision on that. Yes, I do think that open data can actually help misconceptions regarding whether the virus is real and all fake news. I do think that open data is a good tool for that. That's why we are working on actually promoting open data around COVID-19. I believe that the better data, the more data that it's out there, the more difficult it is to create these fake news or misconceptions. Of course, kind of battling these visions, it doesn't just take open data. It needs to be like a broader strategy. But for example, if you don't have that data out in the open, journalists cannot do the proper work to counterpart or to kind of work against these misconceptions and to actually share the scientific side of what's going on. So I do believe that open data can be used to combat the misconceptions around the disease, the vaccines. What we've seen so far, and I think I'm not talking about the open data charter now, it's Natalia, but what I've seen so far is that, for example, the vaccines that have shared more information about their development are the ones that are more trusted right now. So yeah, transparency, as I said, has been like the transparency agenda in open data was kind of thought of being kind of the old school of open data, but this year it was like the cornerstone of every open data policy. Better transparency actually promotes better accountability, and so more trust in what governments or scientific institutions are actually doing. So I would say yes to that. Then the second question, sorry, I'm reading from the screen, so sorry for my image towards. We see that between. So interoperability is a huge issue everywhere. Trust me, I've worked everywhere, fortunately, and it's not easy to achieve. It's not that simple. There are certain countries that have been working on interoperability platforms for over 10 years and still don't have like the whole governmental system connected. Mainly because when the first kind of modernization wave came into governmental offices, it was more based on kind of a ministry per ministry development. So the connection between the system wasn't made in the beginning. So now the investment and the time and the like technical side of connecting all those kind of legacy systems is not that easy. But I know that there's a lot of governments working towards that. There's a lot of institutions working towards that, and everybody understands the importance, of course. I do believe that it's that we need to understand the reality of the work that needs to be put into place in order to have a good interoperability system. But it's doable. We've seen it. It can be done. So it's something that governments should work hard on. And then willingness to achieve data sharing with different countries. I don't know, that would be just an opinion. And I do think that countries are trying to collaborate more than ever, because this is a global pandemic. And everybody understands that the disease just navigates the limits of each country without even caring about the language or whoever it is. So yes, I do think that the pandemic actually has made very, very clear this was another slap of 2020 into our faces. We actually need to collaborate better between the countries in order to better respond to the pandemic. So I do think that that's going on, but that's just an opinion, a personal opinion. Who took part in the COVID-19 meetups? So the meetups, we organized the meetups with governments who wanted to do that, and then it was out in the open for citizens, or whoever wanted to join could join, actually. So we had kind of I don't know, civil society representatives, just kind of citizens that wanted to share, other government workers that wanted to join what the Open Data Office or the Health Ministry were doing. So it depended on each of the meetups, but they were open. So anybody who wanted could actually join. And so we did one in Catalonia, one in Slovenia, one in Mexico, one in Canada, one in New Zealand. So it was interesting to see what was going on. And what the different aspects of data demands were, but also understanding that even in these super different countries that you'd think have nothing to do like one to another, there were certain things that were like matches. Everybody wanted the same. How can the government adopt the International Open Data Charter, yet it's not part of OGP? So we are partners of OGP, but we are not part of OGP. So you can adopt the International Open Data Charter even if you're not an OGP member country. So that wouldn't be a problem. And I can share in our webpage. I will share the link in the chat room. You can see all the information about how to adopt the Open Data Charter. And of course, we work with OGP and we are very good partners, but we are not the same institution, and we are not like one isn't part of the other. So there's OGP member countries that are adopters of the Open Data Charter. There are OGP member countries that are not part of the International Open Data Charter, and there are members of the Open Data Charter that are not part of OGP. But as I said, we collaborate a lot.
Great. Just to add on the last remark, Kosovo, however, it's not officially, we cannot say that it's part of International Open Data Charter, but we can say that it has adopted some of the principles as spread between the institutions. So yeah, and also additionally, we at Open Data Kosovo, we're currently working on some efforts to join the Open Government Partnership. So there are efforts being done as we speak. So I just wanted to share also this, since you already have been part of both institutions working closely. So thank you so much for your answers and for your presentation. I would just, for the last time, I would just like to see if anyone wants to also jump in and have any other final question for our final session. Since it's a virtual one, we didn't want to take much more of anyone's time, because we understand that now we're all living in Zoom. So we just didn't want to. We want to respect everyone's time. So thank you, Natalia, so much. It was really nice to virtually see you, and hopefully we will meet again very soon.
I think
Yes.
I have a question. Can I jump?
Yes.
Okay.
Hi, Natalia. Thank you for this very interesting and comprehensive presentation. I think it was quite intriguing to see your methods and all the steps that you are following to respond to COVID and use open data in this aspect. So my question is that, let's say, from what we saw during the COVID, most of the countries were sort of developing isolated strategies. I mean, everyone had their own strategy to tackle COVID. And let's say if we can separate countries between those with developing countries or those who are already developed, or I would say those with developed public health system and those which are already developing or working on it, which were more responsive and more proactive in terms of using open data to tackle COVID challenges, or were both the same? I mean, were all the countries were willing to participate, or there were some who were more resistant towards?
So I don't know if it, because we don't make governments open up data. We promote openness. So response is different everywhere. From the studies that we've done, we've seen that the better response came from those countries that already had an open data initiative policy or office that was more developed through time, and that doesn't kind of mean anything as far as like the economical development of the country. And those that were open like right away actually had better response from their community. One example, for example, is Colombia, which is a rather developed country, but still has certain indicators that are not, for example, at the level of an European country, but they do have an open data initiative that's been going on for very like a lot of years now. And what they did is they published a first tier of data related to COVID, and they got a lot of requests from the open data community, kind of asking about better standards or better quality. So what they did is sit with everybody virtually, of course, but they brought everybody in and worked towards making a better publication of data related to COVID, and they actually republished, started publishing with new standards and better quality as request of the open data Colombian community. So it doesn't have to do that example also has to do with, it's not just the governmental side, it's also civil society. They requested and they actually collaborated with government. It's not just kind of pointed out the finger like this is wrong. They actually said like this is wrong, but this could be the way to do it. And so they sat and collaborated. So it's what we call the open data community working together. It's not just government. Of course, the publication came from government. They have the responsibility actually to publish that data. So we need to understand that governments are responsible for that publication. But in that case, the collaboration with civil society actually made all the work better. So I don't think I have like one answer on which country did a better job and what it actually changed. I don't know if it's even country by country. It changed to month by month. There are certain countries that didn't publish anything, and then all of a sudden started publishing with like amazing standards. So I wouldn't want to say just like who did it better.
I was just interested to know if, let's say, if COVID managed to sort of melt this developing and developed distinction, you know?
I don't feel comfortable like saying, because I know I studied certain amount of countries, but I wouldn't be able to do like, I would go to the Johns Hopkins University map and try to figure that out. But I can share, I can share the examples that we've worked with and the examples that we know, and what we've seen in our study has to do with the better openness policy around COVID had to do with the readiness they already had. So those countries that already had an open data policy set, like a team working on that for a long time, and the systems already in place, actually were the ones that better published COVID data from the countries that we studied. So I want to be super careful about that, because we didn't study the whole world, and as I said, this kind of changed all the time.
Thank you.
Have anyone else that would like to ask any questions?
First of all, you're not allowed to look at the iPad.
I see. I saw an open mic, but I'm not sure. Okay, so I think we're done with the questions. And once again, I would like to thank you for your time and for valuable feedback. We hope that this pandemic is going to end soon, but it also at the same time brought us many, many thoughts and interventions that otherwise we didn't kind of had the chance to look at this perspective. So I think finally we are all having a thing in common that we are trying to, solve.
Totally. And there in the chat room, I left our webpage and my email, so please reach out and follow us on Twitter also, so you can see the reports that we will be sharing early next year around this work and any other work that we do. So thank you very much for the invitation, and happy holidays, everybody.
Happy holidays from Kosovo as well. Thank you all for joining us today, and feel free to use the document. And also, if for all of you that couldn't join us from the beginning, we have already shared on our Facebook profile, Open Data Kosovo, and you can rewatch all of our sessions today and have all of the questions and answers to the document that we already shared. Thank you so much for joining us today, and I hope that in the next year it will be face-to-face and not virtually. All the best and happy holidays.